Everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And in this one, I'm going to share with you a case of a patient that presented to my office. He's 14 years old. He presented with his mom. And prior to the appointment, I spoke to his orthodontist, and the concern was soft tissue recession, gum recession, and he was about to start orthodontic treatment, already started, just at the first steps of ortho. And the concern was with the soft tissue. So I wanted to look at some pictures with you. We have the panoramic view. This is a little bit old. He already had all his teeth erupted to this stage. But basically, the patient's concern was that the canines and lateral incisors have recession. And I know it can be a little bit misleading at times, but really if you look very carefully at the clinical crowns, and I'm going to zoom in a little bit. If you look at the clinical crowns of the canine and the lateral, on both sides, there's only enamel exposed. There's no cementum or dentinal exposure. And the reason this looks like gingival recession is that the maxillary incisors are short. There's still some excessive soft tissue. The clinical crown exposure is likely to complete itself later on. This brings us to a very important point to understand how the process of eruption works. There are two steps of the eruption process: the active eruption, where the tooth erupts from the jaw, and the second phase is called passive eruption, where the soft tissues retract and expose the full clinical crown. So what's happening in this case is that the central incisors did not complete the second part of the eruption. So basically passive eruption is not fully completed yet. And once this happens, the full extent of the clinical crown will be exposed. Now if that does not happen, that means that this patient has a condition called delayed passive eruption, and they can benefit from aesthetic crown lengthening later on to expose the additional clinical crown. And delayed eruption doesn't only happen on central incisor, it can happen throughout the mouth. If you look at this patient's lower incisors, we can see that the clinical crown is not fully exposed yet. Now this patient is 14, so that may never happen, and of course this will also not be an aesthetic problem, but generally speaking, I'd like you to be aware of the phases of eruption, because that will be extremely important when you're considering aesthetic crown lengthening to improve the teeth proportions and the overall aesthetics of the smile. You'll have to know that if there is a delay in any part of the eruption process, the final outcome is that the clinical crowns are short, and that can lead to aesthetic problems. Okay? Going back to this patient, the only concern that I saw was around the canine, not so much gingival recession, but poor tissue quality, what we call minimally attached and keratinized tissue. And that does not need to be treated, but this area needs to be definitely monitored throughout orthodontic treatment to see if it gets any worse, and it may require some treatment in the future. So at the moment, this patient and mostly his mom are extremely happy that no treatment needs to be done. And I wanted just to kind of bring up the point of the different types of eruption, because that will be extremely important when we talk about aesthetic crown lengthening. Speaking of that, if you're watching this video at the moment, we have a waiting list for the crown lengthening online course that is coming up soon. If you're watching it later, it may have come out already. Basically go to crownlengtheningsurgery.com to join the waiting list, and if it's out already, this link will lead you to sign up for this course. I hope this quick video was helpful to you in understanding more of the eruption patterns and alleviating patients' concern. I'll see you in the next video.